Thank you, Mr. Chairman. Actually, you just answered the question I was going to ask, but I guess my point, I'll just make, Commissioner, is I know you guys have been making some tough decisions, that before we make tough decisions, and when it gets down to blind children and children with autism, it seems like we're really, what you're saying to us is, we've cut everything else we can possibly cut. This is where we are. And my question, sometime this session, I would like to have full confidence that you all have cut every area that does not directly impact services first, so that when you come to us, you can say, we have cut every inefficient program, every unneeded program, every administrator who's not vital to our operation. Because for me personally, when I look at children with autism and blind children, we're talking about from 180 to 90. I want to be sure you cut to the bone everywhere you can possibly cut that does not impact people. And at this point, and you may be on that path and you may have done it, but at this point, I don't have, not the confidence, I just haven't seen it, and sometime before I cast a final vote, I'm going to really need to see that.
Senator, I think as we work through the budget process, you'll see that more and more. It doesn't mean there's not going to be areas that I'm going to ask for administrative dollars, because there's some areas I've got to have the administrative dollars to generate the savings elsewhere. For example, Dr. Jewell talks about our front-end screening, where we're shifting over to make sure we're getting other people's insurance, third-party insurance. Come this summer, we're going to be moving that to the front end on the ID. Instead of waiting until after we pay the bill, we're actually going to not let the physician bill us if there's any other insurance they have to bill first, which is different in the system. Well, those type of things cost me some money.
Sure.
So I'll try to squeeze. I think that's our goal, is to squeeze as much as possible. Does it mean we've identified everything? I doubt it. I'm still concerned about fragmentation and duplication in our system. I just think we have so many different entities involved in healthcare. I can't sit here and tell you that we're as efficient as we can be, because I don't believe it. I think there's other things, and hopefully through this process, some of those items will be identified, and we'll agree on doing some things differently to generate additional administrative savings or programmatic savings without reducing services to clients.
And I have confidence that you will get us there and get us that information, but I have over 3,000 families in Senate District 7 with children with autism, and before I look that parent in the eye who asked me that question, I want to be confident that I can say the agency, in the broad view, has cut out every unneeded dollar possible before asking that child with autism. So thank you. I
totally agree.
want to be sure we get there.